Namaste. Welcome to the next episode of Clinical Ayurved. Myself, Dr. Mayuresh Agte. We were discussing Medhya Karma and we have discussed about Dhi and Smriti. Our next case is that child has good grasping power, good memory, but at the time of examination he becomes unstable, he gets under pressure and he can't perform to the optimum level. Obviously, this patient will be required to have treatment on Duti. Duti means dhairya, to face down the situation calmly, bravely, strongly. There is another good word which I like for Duti, which you must have heard during the cricket match. When there is, say, situation is 20 balls remaining and 40 runs are required, 4 wickets in hand. In that situation, the commentator always speak that particular word, which is that temperament. The player who will show the temperament will win the match. The player who will be calm down in this situation will win the match. So this temperament, this calming down and facing the situation is called as Duti. And there are many examples where Duti is more required. For example, a surgeon is performing a surgery and some emergency happens during the operation. Now, he doesn't require Dhri, because he has already learned how to operate. He doesn't require Smriti also, that I have operated 100 patients and what I have done at that time. He has to face that particular situation in front of him with a calm and brave mind, a stable mind. So, for Dhruti, for Dhairya, we require a stable mind to face that situation. So, automatically, which guna will be good to improve the Dhruti or Dhairya is Sthira guna. When you are unstable, you will not face any situation in life. But on the contrary, when your mind is stable, you can understand the situation around you and you can think how to make a path in that situation. So, when this temperament or Dhruti is to be treated, you have to think of the Sthira Guna. Hence, in such patients, the drug of choice will be like Jatamansi, which is of the Sthira Guna. So, it will make the mind stable and person will be efficient to face the situation very calmly, with stable mind and bravely also. So, when Dhruti is the case to be considered, we should consider Nidya Dravyas which will have Sthira Guna. Now I will put my one opinion in front of you. This Dhuti factor is mostly required in our daily life. See, when we are learning, the Dhi is required. When you are going to exam, the Smriti is required. When you get new job, you have to again have more use of Dhruti to set in that job. But after some time, when you get enough experience, your study is over, you are the job, now you are settled in that job, what remains is mainly Dhruti. Because the ups and downs in that job or the difficulties which come during your job or daily life, the Dhruti is required. And there are many difficulties which have been circled around us, like even social difficulties, including traffic or etc., behavior of people, behavior of colleagues, many things which day-to-day life, like getting of the electricity, water shortage, etc., etc., etc. And these incidences occur day-to-day basis and you have to face them because you have no choice. Hence, in my opinion, this is my opinion, in our today's life, Dhruti is much more required factor to face our daily life problems. And hence, in this condition, Sthira Guna is more important. Another good thing, or which I suggest to the patient in this situation, is Dirgha Shvasan. See, pranayam and pranvayu has control of mind, and under mind all these three factors come. So, unstable mind, you have to make it sthira. So, when you will have a control on the pranavayu, you will automatically mind, it will help the mind to become stable. Hence, in my practice, I suggest the patient to have Dirgha and Santha Shvasan. It will calm down the gati of pranavayu, and ultimately the irritation of mind will also be towards lower side. Of course, this requires a daily practice for few days. Once it is achieved, you will find that the Dhruti is definitely improved, and we can sustain the daily life problems with much better way. We have seen these three patients which have problem with Dhi or Dhruti or Smriti, and we are giving treatment to improve these factors. But there are many situations where Dhi, Dhruti, Smriti are normal, but they are affected by some other diseases or symptoms. We will discuss them in the next episode. Also, a homework for you, in our text, Ghrut or ghee is recommended as a Medhya. We will discuss this point also in the next episode. Homework for you, see the properties of Ghrut and just think how it can be useful for Medhya Karma. Before concluding, I request all of you to give your suggestions in the comment box so I can improve my this short lecture series in a better way. Also suggest if any topic you want to discuss. So it will help me to guide in both ways to improve my discussions and also to choose the topic. Thank you very much.